Beginning in 1981, the infamous and deadly disease we all know as HIV and its late-stage condition, AIDS, started to spread around the world. While HIV could be contracted by anybody, it infiltrated the gay communities of the United States and started killing people rapidly. In 1987, New York, being a cultural center and populous city in the United States, it was impacted greatly by the spread of the virus throughout the LGBT community. It had been 6 years of thousands and thousands of deaths, and with little intervention or support from the government. Essentially, they felt that they were dying right in front of the face of the public and the government, yet being left to die. In the basics of sociology, Joe Freeman established the 4 necessary means for a social movement to exist. The first component is a pre-existing communications network that brings people together, people who may have similar interests and participate in a common goal. In 1987, the Gay and Lesbian Community Center was a vital safe space and support system for the LGBT community in New York City. The center ran several cultural programs and events, such as the Second Tuesdays lecture series. However, as Freeman states, there needs to be a spark that ignites a movement in an effort to organize. On March 10, 1987, a contributor at the event made a speech that ignited the movement. Filled with the shared anger of the neglect of the community struggles for 6 years, Larry Kramer, a writer, spoke to the crowd and expressed the need for a formation of a group to fight for their rights and get the help they need. ACT UP was established in these moments, and after that, they went on to champion an iconic movement using their anger and community as their power. The group was extremely effective because they used direct action that demanded immediate change through the use of theater protest, creative disruptions, banner hangs, and blockades to make the invisible, the thousands of deceased victims, and the vulnerable community visible. The movement had a few goals and targets, although overall their mission was to fight for their lives and demand support and visibility of the crisis that was occurring. To do so, they committed to direct action. As described in Beautiful Trouble, direct action means to take collective action to change our circumstances without handing our power to a middle person. It puts the power in the people and gets things done by themselves with their own actions. Fueling this action, a significant portion of the group's anger was related to the lack of government funding, concern, or intervention present in the Reagan and then Bush governments. They did not acknowledge the situation as what was actually happening, a severe health crisis, because of the community impacted and the stigmas involved. Instead, the queer communities of the United States were left to fend for themselves while people were dying exponentially. They felt that their leaders were complacent in their devastation and demise. To protest this and demand attention and change from their leaders, they participated in mass street action. This tactic can be identified as to pressure a corporate or government target with a mass of people in the street telling a unified story. A lot of these strategies of ACT UP were to take to the streets and mass groups with the goal of pressuring the government in office. They used signs directed to Reagan and Bush and chants that called them out for their neglect and complacence. The first large-scale ACT UP march, the Gay and Lesbian March for Rights, took place in October of their very first year, 1987, and they called on the government to intervene and fight the spread of the virus. By bringing thousands of people together to march for one single purpose, they put the eyes of those in power on the issue and pressure on them to do something. Throughout the decades of the movement, street action is what united the people of the affected country-wide communities and turned their anger into power. Along with the power they exerted through their street protests, ACT UP's use of physical media helped pressure the government and hold them accountable. They took to advertising with posters that called out politicians, aiming to get the public to understand their faults. They used signs, posters, and banners, but notably used banner hangs as protest. A banner hang is to boldly articulate a demand, to provide a message frame or larger-than-life caption for action. Banner hangs can either be communicative statements or concrete forms of interruption, but either way, they directly target an institution and make it face a flying message of protest. ACT UP targeted political institutions, specifically the president and ruling party, and hung a banner on the gates of the White House that stated their slogan, "Silence equals death." They even used communicative banners on a smaller scale, like their use of taking over Grand Central Station with this banner and demanding the message to be seen by taking up space. Past just government responsibility and the demanding of acknowledgement, ACT UP overall aimed to destigmatize the disease and explain the severity of the situation to the public. They aimed to spread awareness of what was really happening and being ignored, so they needed to gain attention. To do so, most of their efforts could be described as street theater, the magnifying of an issue through performance or drama. ACT UP participated in dramatic performances called die-ins, in which they took up public space by lying in the street, appearing to be dead, in order to represent the thousands of deaths occurring and to force the public and the powerful to acknowledge what was happening. They forced the state and other institutions to physically move the protesters and pay them attention. They also worked to gain empathy from the public and destigmatize the illness. There were real people dying because of stigma. They directly targeted the emotions of the public to gain attention and force people to acknowledge the unseen epidemic. Theater involves the grabbing of attention and demonstrating in the public eye, and ACT UP did this by creatively disrupting public spaces. Creative disruption is to expose and disrupt events of the powerful by inserting a protest symbol or statement. On January 3, 1990, protesters disrupted the governor of New York, Mark Cuomo's speech in order to call attention to his complacence in the AIDS crisis. By interrupting public speeches of the enemy, protesters demand the attention of the public. They also interrupted a news broadcast on September 1, 1991, shouting, "Fight AIDS, not Arabs," once again demanding the attention of the public in a situation that they knew eyes would already be looking, to force the public to recognize and contemplate the devastation happening, and realize maybe people should be in an uproar at this crisis. Another one of their goals was to directly intervene in the institutions that contributed to the epidemic and their lack of care. One organization that was complacent in the AIDS crisis was the FDA, for its slow approval policy and lack of urgency in releasing accessible drugs that would save many lives of those infected. In October 1988, ACT UP directly attacked the FDA, although not violently. They put direct pressure on the institution to make a difference, and this was their first national action. They sat in die-ins, hung banners, but they also created a blockade. A blockade aims to either shut something down, protect something, or make a statement by creating a physical barricade. This can be either a soft blockade, made by human bodies that are interlocked, or a hard blockade which uses more materials and gear to support it. But either way, the goal is to put pressure on a point of intervention, a place within a system that can be targeted to interrupt a system and create change. Members of ACT UP blocked the entrance to the headquarters of the FDA, a place that was directly contributing to the crisis, and effectively shut it down for the day. They also called this seizing the FDA. They brought attention to the institution, but also prevented them from being able to carry out the corporate production for the day, and put pressure on those who make the decisions. Overall, ACT UP was extremely effective in its principles of direct action. They physically went into places of actions and did things themselves. They carried out their goals of getting the public behind the fight against AIDS and championed for many changes towards the support of the community. They helped establish the first needle exchange program in New York, helped to initiate medical policies like the AIDS Drug Assistance Program, and overall gained worldwide attention and acknowledgement of the crisis.